Well, I think maybe we should just get started. So thanks so much for everyone who is joining us. We are so excited for today's panel and to talk about when people can get back to exercise postpartum. I know it's a topic that's really important as people think about, wanting to re-strengthen and kind of get back to some of the activities you were maybe doing pre-pregnancy or during your pregnancy. But to kick it off, I just want to give a little bit of context about Origin. I am Allison Grant. I am the head of marketing at Origin. We are physical therapy for women and mothers, and just opened our clinic in San Francisco this month, which is headed up by none other than Liz Miracle, who's joining the call as one of our panelists today. But really, we are on a mission to help women feel good in their body, kind of at every stage of life. So we offer physical therapy that really helps with everything from sexual health to during pregnancy to postpartum recovery, and then even into menopause. There's a lot of, I think taboo things that women are told, maybe not to talk about, or that these things are normal. And we really believe that there's no such thing as TMI. And if there's something that feels off or wrong in your body, or you just want to prepare yourself for labor or have more pleasurable sex, that's all kind of stuff that we can help with. So with that, I will introduce today's panelists. We have an awesome, incredible group of women from the San Francisco community who are going to be talking today about returning to exercise. So we have Liz Miracle, who is our clinical director of Origin. Liz is originally from Texas and has been practicing physical therapy for 15 years. She also has a young daughter, so knows a lot about returning to exercise postpartum. She's a avid runner, at least used to be before we probably started working her so much here at Origin. And she also is assistant clinical professor at UCSF's physical therapy program. We also have Jane Austen with us, who runs Jane Austen Yoga. She's worked with pregnant women and their families since 1990, so she is a true OG in terms of knowing about prenatal yoga and exercise. She's a certified yoga teacher and trainer, and is the founder and director of Mama Tree, which is a prenatal yoga school dedicated to educating yoga teachers, doulas, and midwives on how to use yoga to support pregnant women and new moms. So she will certainly have a lot to talk about on this topic. And last but not least, we have Caitlin Ritt, who is the founder and CEO of the Lotus method. I had the pleasure of having a class taught by Caitlin, and I can assure you that her workouts are hard but fair. And she does fitness design for motherhood. She herself is an ex-ballet dancer. And the Lotus method does a combination of both in-person and virtual training with really fitness that's tailored to motherhood. So with that, I will turn it over to Liz to lead our discussion today.
Thank you, Allison, for those wonderful introductions. And I don't even think, Jane, did you put in your intro that you were a midwife? I feel like that's like an...
Yeah. I think that was kind of an old bio, but yeah. And I have 2 kids, so.
Yeah. So you have your own legit experience as well. So I know that we already have a bunch of questions that have been brought in by the listeners. And so we're going to try to hit on some of those, but if we miss them, if you feel free to put them in the chat, Allison will feel free to interrupt us or ask questions. We can just have kind of a conversation about anything that's up at your mind. So we have some slides we're going to go through, but if we veer off of that, because we have a great conversation going, like I'm really excited about that. And I think we've got some really good different perspectives here. So we're going to start off just talking a little bit about the basics of your pelvic floor and what it does. Perfect. Great. Look at that. I don't even have to do anything. There's a beautiful picture here that explains it. So for those of you who aren't particularly sure what your pelvic floor is, you can think of it like a hammock of muscles that's sitting inside of the pelvis that supports the organs when you're pregnant, your baby. And it's going to help you hold back your urine. It's going to help with making sure that you can evacuate your bowels. So it plays a role actually in trying to release when you're having issues like constipation. And it also helps to create stability. So I want to bring this back to, thinking about yoga with this, Jane, which is, I've always asked people, like, if you do something like a tree pose in yoga on one leg and then you contract your pelvic floor, do you feel a difference with your stability and your balance when you use your pelvic floor versus when you're not using your pelvic floor in those type of poses? So people don't usually think about their pelvic floor being something that creates stability, even though they may know that it actually helps with the core. And then it's also, I think the pelvic floor gets a lot of hype when it comes to sexual function. And mostly what we're going to be talking about today is going to be sexual function and from the perspective of the woman. So how she's going to be able to feel like more in her own body and less maybe about thinking about it in terms of whether or not it's pleasurable for your partner, but how you're feeling in your own body. So we welcome any questions about that, but that's going to have a lot to do with orgasm and potentially pain, especially if you've had pain in the past before becoming pregnant. We want to talk a little bit about that. And then maybe if you're having discomfort after you've had your baby related to either just soreness or maybe if you had a tear. And then the muscles also actually act like a sump pump in the pelvis. So after we have a baby, there's a lot of swelling that happens in vulvar tissues. And those pelvic floor muscles can help to contract and relax to help get some of that swelling out of that area. So a lot of different functions for the pelvic floor. I'm like, next slide. So a lot of what we're going to be talking about today is like, what do we do postpartum after the baby, getting back to exercise. So I'm going to kind of take it from the pelvic floor perspective. And then we've got Jane, who's got her wealth of knowledge, and Caitlin, who's got her wealth of knowledge in these different realms. We're going to kind of try to mesh that all together. So from the pelvic floor perspective, in that first 6 weeks after you've had your baby, and this is going to be regardless of whether or not you had a vaginal or a cesarean birth, there may be some leaking of urine. So a lot of people think that just because they've had a cesarean birth that they are going to be free of having issues that are related to the pelvic floor, and that's not necessarily the case. That can happen. And so we have this slide here that says that leaking urine and a feeling of heaviness is normal and may improve spontaneously. I want to be really careful about the word normal and just explain to people that normal in this context means that it is common, that a lot of people may have that, but it is never normal to leak urine or to have a constant pelvic heaviness. So if that's something that you're continuing to experience once you've hit your 6-week mark, please tell your physician if your physician's or your midwife isn't hearing. Usually midwives hear you on that, but if your physician isn't hearing you on that, make sure that you get a referral for pelvic physical therapy so we can see what can be contributing to that. I often tell people in those first 6 weeks, I say as soon as you have birthed your placenta and if you had a tear and received stitches, as soon as that's happened, you can start trying to connect with your pelvic floor. And I don't mean in a way where we're doing these long Kegel holds, but more in a way where you are inhaling and letting the diaphragm and the pelvic floor release. So like a big belly breath to open, and then exhale, where you try to contract the pelvic floor muscles like you're stopping the flow of urine and keeping back gas at the same time. So some people that may feel really foreign to you and you may not feel like you're doing that correctly. If you're already postpartum and you don't feel comfortable doing a self-exam right now because you're in those first couple of 6 weeks before you've had your checkup with your physician, you can just look with a mirror and see if you actually see the clitoris and the anus nodding toward one another. If you see the opening or the introitus of the vagina closing kind of like a sphincter, you would want to see that, and you would want to see that muscle between the vagina and the anus start to pin tuck into the body. If you're not in that first 6 weeks and you feel confident and everything is healed and you want to try to do your own self-exam, if you were to insert a finger vaginally, you would feel as though a tongue was lifting your finger to the roof of your abdomen, like that deep inside. And then you would feel something squeeze around the base of your finger like this, almost like that sphincter motion that you would be seeing with the mirror. And hopefully you would feel a lift coming into the body up toward the head. That's really only going to happen if you have a very strong pelvic floor. So in those early weeks, you're probably not going to feel that lift. But if you only feel one of those actions, that means that something is missing. And so you can start to work on your breath and trying to gain a better connection with those actions. We want to do that breath squeeze and release to act as that pump to try to get the swelling out. And then just start with gentle movement like walking. I would love to hear from you, Jane and Caitlin, any recommendations you have in those 6 weeks that might be related to exercise before you actually get like the clearance or check off from your doctor.
Sure. I'll just hop in here, Liz. Thank you. Thank you for bringing breath because that's really the foundation. And of course, from the yoga practice, that's where we begin. We begin to bring our awareness to our breath, and the breath can be such a great bridge to help reestablish the neuromuscular connection, because for many people postpartum, they feel really disconnected regardless of vaginal birth, cesarean birth. They can just feel maybe a little nervous about looking down there, but beginning to use the breath to help you find that connection can be really, really, it can be really, really helpful. So you can do that literally, like, I mean, I love what Liz said, like right after you give birth. So it's not like you ignore your pelvis and your pelvic floor. I do, probably there are many of you that have already had babes or already had your baby, but if you are pregnant, I am a big fan of knowing your anatomy and looking at your body even before you have your baby, because if you don't know what you look like before, how are you going to compare it to what it looks like after? It will look different, but I think it's helpful to kind of not be afraid of your body. You know, I always say I'm not afraid of any of the holes down there. So I love that Allison said there's no such thing as TMI, but breath can be such a great way to make that link and that connection.
Thank you, Jane.
Yeah, and breath is absolutely the first place we start as well with strength training, and at the Lotus method, it's the foundation of everything we do. When you think about how to integrate that pelvic floor and that core into the movements, it starts with that breath pattern. I really like the cue, and Liz has heard me say it a few times, of like, as you inhale, like she talked about, using that diaphragm, breathing into that pelvic floor. So you find that softening and that load. And then can you gently think of, she used the clit and the anus coming towards, I like picking up a blueberry through your vagina. Can you gently bring that up towards your belly button? Another way, once you kind of integrate, oh, you hadn't heard the blueberry?
Oh, I been teaching blueberry breath for years.
Oh, perfect, great.
So
I figured.
The same fruit.
Perfect, same fruit.
I don't know.
Blueberries it is.
Sometimes mine feels more like a plum.
I've had women ask for like cherries or Bing cherries, whatever fruit tickles your fancy. And then just kind of like, what Liz was talking about as far as people not thinking about the pelvic floor as far as stability and things like that. It's also, it's a musculature of your core. It's not separate, right? It works in conjunction with your transverse abdominis, which is your deepest core musculature. So something that, after we get that kind of pelvic floor connection, the next thing we kind of work on in that next step is that transverse. So you can put your hands on the inside of your hip bones and even do just a little like cough and feel that kind of engage. And then can you, after you lift from the pelvic floor, can you feel those hip bones start to narrow up towards that belly button? But breath is absolutely where we start.
Yeah, and I think the biggest thing here is gentle in the first 6 weeks. In a lot of other cultures, you're taken care of in that period of time. People bring you your food and you're resting and you're really kind of bonding with your baby, and you're not trying to go run a marathon in those first 3 weeks or first 6 weeks. There was a pre event question that came through that was like, if you're feeling okay and you don't have any symptoms of any kind, can you start running quite soon postpartum? My answer is no. Typically we recommend 3 months, even if you're feeling okay, because the body needs time to come back together. Your uterus is still involuting and coming back down to, I don't want to say back anymore. I want to say coming forward, coming forward. It's going forward to where it needs to be. It's not going back. I just love that. I just love that. I am like going to say that a million times. And I've had plenty of patients who are maybe feeling really fine, and then they go for that run too early, and then it's not fine anymore. So do yourself a favor. And I know that can be really hard, especially with COVID, when our only outlet is trying to get outdoors and do things and be with our family, but just keep it to a walk if you have to be outdoors and doing something, and don't do anything high impact in those first 6 weeks, and I would say first 3 months actually. So I don't know if either of you have any thoughts and comments on those early days.
I'm with you. I'm sure we're all on the same page with this. What we know is that in that postpartum period, especially if you're breastfeeding or chest feeding, body feeding, that you're still going to have that relaxin and softening hormones in your body. So you're going to be at increased risk if you're doing high impact stuff before that uterus is completely like nice and small again. You're at increased risk for uterine prolapse of the other organs, the rectum or the bladder as well. So nourish yourself, feed yourself, be kind to yourself. I always tell my students that you have a lifetime to do yoga. So what you do immediately postpartum is really, really important, that you take it easy and build the foundation. So build the foundation so that you can start, you can put in the walls and the floors and then finally put the roof on. But start with the foundation. If you start with the roof and you don't have a good foundation, you're not going to be stable.
Yeah. And I know that there have been some questions about, what about cesarean, and, how can we start the abs really early on? I think, first of all, we've talked a lot about breath. The other would be, if you want to do something on hands and knees, you can put your baby right there underneath your face. You can be over your baby, giggle and laugh with your baby, but just breathing into the belly, letting the belly expand, and then exhale, drawing the navel in toward the spine. So that is the very basic starting point of abdominal exercise, and trying to get that connection back with those muscles that have been stretched and are having to come back, or having to bounce forward into the back, and getting them where we want them to be, and just get that connection in place. So I see plenty of people who come in postpartum and just can't even find those muscles at all. So if you can jumpstart on that in those first 6 weeks, it's going to help build that foundation for you to get back to, or to help you get to whatever practice you're going toward. I'm really working on this language thing, Jane. I think if I'm going to keep correcting myself. Wait, we got to go back to that slide though. Allison, sorry about that. We jumped forward. So after 6 weeks, I just want to talk a little bit about the medical side of this. We do want your OB or your midwife to clear you. So for physical therapy, we're not going to be doing any type of an internal pelvic floor exam until you've had your 6-week clearance. But that doesn't mean we can't do a virtual visit with you and talk through some of the concerns that you may be having, the symptoms that you're feeling. And we can always do an external examination. We're just taking a look if you come into clinic. And if you're having symptoms of urinary leaking, that's not normal. Heaviness, that's going to be related to that word that Jane used a second ago, which is prolapse. For those of you who don't know what that is, that's where the organs in the body have lost their ligamentous stability and have drooped down into the vaginal canal. And so the way I like to describe it is if you're in a room, and the room is made out of latex walls, and there was like an elephant on the outside of the room, and the elephant was trying to push itself into the room. That would be like the bladder pushing itself into the vaginal canal, or the rectum pushing itself into the vaginal canal, or the uterus from above. The organ isn't actually coming out of your vagina. It's still in your body technically, because it's behind the vaginal wall. But sometimes that bulge can be quite large, and we can see that bulge coming all the way out of the vagina at times. So everybody has different degrees. I think there was a question about grades of prolapse and return to exercise. I definitely am like, I want people to be exercising, but just to be mindful of how they're doing it, and that they're connecting their breath, and that they're lifting the pelvic floor. One of the things that I do with patients is to incorporate vaginal weights when they're needing to lift and try to, like pull the pelvic floor muscles to pull the organs up. I have a picture of vaginal weights here. This is actually the brand that I recommend for a lot of people, which is Intimate Rose. But I don't like it really early on, because if you put a vaginal weight in and you're not quite strong enough to hold it in and it falls out, it can be quite demoralizing. So I want to, I really want to work with people with where they're at, and you may need to start doing some pelvic floor exercises in different positions, like hands and knees, downward dog, maybe a bridge position, because that would be anti-gravity. So those are some places that we would start. And we would also start to work on scar massage around that 6-week time. And then you could start doing a smart trainer. So that's what these, probably a lot of people don't know what these are, but there's a picture here of one called the LV, which is that green one, and then another one called the Kegel. And then there's a third one called the PeriFit, which is like a hot pink or green one, which I didn't have room for a fourth picture on here. But those are trainers that you would insert into the vagina, and then you would play like a game on your phone where you do pelvic floor strengthening. But you really want to be cleared by your provider before you use something like this to insert. And they all have different qualities, they're different sizes, and they would have different fits. So that might be something you might want to talk with a pelvic floor therapist about before buying one, because they can be quite expensive. And you also don't want to try something and it not work and then feel really like, oh, that didn't work, I'm not going to do it. But if someone just gave you a little bit of guidance, maybe they can show you how to use it in a way that would be really helpful for you. And I think after 6 weeks, do you guys have any anything to add to the between 6 and 8 weeks. 8 weeks is, I just wanted to kind of put that in there because there are a lot of people out there that get very concerned in the early days about separation of abdominal muscles. And that is extremely normal to have, and I will say normal because this is true. So your abdominal muscles have to separate to make room for your baby. If you carry to 40 weeks, you will have a separation. You are not going to get away from it. There are multiple high quality research studies that tell us that if you carry to full term, you will have a diastasis. Okay. So that's not something to get concerned about. It's in that postpartum period. If that diastasis is lasting more than 8 weeks, that's when we want to say, okay, this didn't resolve on its own. We want to make sure that we're addressing it. It doesn't mean that we're waiting till 8 weeks to start working on our abs, right? Like I already talked about getting in quadruped and trying to draw the abdominal muscles in and starting to work on that stability. But I don't want to create a sense of fear in people because they have a diastasis in the early days. So I usually, yeah, Jane, please.
Oh, I just wanted to add something. So the 4 to 6 weeks after vaginal birth is what we say to come back to like a yoga class, 8 weeks after a cesarean birth to come to a yoga class. But those are basic guidelines. It really depends on how your body recovers. So there are many, many, many people that don't feel comfortable really starting to do more rigorous activity until 3 months or even 4 months, depending on like what their postpartum support looked like, how their body heals. So just know that these are guidelines. And if it's taken you longer to get back to exercise, please don't feel guilty. It's really a personal gauge about what is right for you, and everybody will be really different. So don't feel like you've missed the boat if you are 5, 6, 7 months down the road and you haven't exercised at all. It's okay. So just show yourself a little loving kindness, and that'll help a lot.
Yeah, and you've got your entire life to return to exercise, right? It's called the 4th trimester for a reason. You have one time to heal. So give yourself that time. And again, it doesn't mean you can't do some things to work on integrating your pelvic floor and core prior, but give yourself that time. You have the rest of your life to grow out and get back to running or whatever it might be. And when you do return to running or something like that, that person who asked about, if I felt okay, can I run? When you do actually hit the pavement for the first time, don't go, oh, I used to run 5, 6 miles. I'm going to go out and run 5, 6 miles. Jog for a minute, walk for a minute, jog for a minute, walk for a minute, and then see, do max 20 minutes and see how it feels, and then build upon that. Honestly, even before we have women do that, we have them stomp or do little jumps. Once we've built up to hip stability, once we're at that point, we want to do some impact in a place where we're doing pelvic floor and core contractions with it before we go and hit the pavement and go running. So just honor that time. It takes, you have your whole life to exercise. So just, reiterating that.
Great. I think that was this whole slide.
Oh, sorry.
Perfect.
No, that was fantastic. It was Jane hit it before she switched slides, and then you hit it on the other side. And I was like, great, we just did that whole slide. That was awesome. If you are wondering, did you see a PT or not? This is basically the list if you want to screenshot it. Urinary leaking, a sense of urgency, heaviness in the pelvis, you're having painful sex of any type. I work with a lot of people on preparing their perineum for birth who have a history of painful penetration prior to, and we get great outcomes, which I just love. It's one of my favorite things. And we do
Liz, we had a question
perineal
around
and cesarean scar work.
We had a question around orgasms felt better pregnant than postpartum. Is that because of my pelvic floor?
I wouldn't say it's because of your pelvic floor. My question would be, are you talking about an internal body orgasm or a clitoral orgasm? Do we have the person with us to answer that question?
It was just in the Q&A anonymously. So we'll see if they come back in, but
so sometimes when you're pregnant, it can just shift the anatomy a little bit in a way.
We got it. It was clitoral, Liz.
Oh, it was clitoral. Okay. That's interesting. the only thing I could think of would be we have erectile tissue behind the superficial muscles of the pelvic floor. And if there's some extra weight there, it could be helping that erectile tissue to get some more pressure on it. But I know that there's hormonal shifts in pregnancy that could be potentially making things feel that way. You hear people talk about orgasmic births. So it's, I wish that we had a little bit more science around sex. Unfortunately, we don't. It's, I think just it's sad we're so far behind in terms of research, just in terms of women in general, but even trying to understand our sexual response seems to be a challenging thing in terms of like really understanding the reasons for some of those things. I was thinking it was actually more the internal sensation, but usually if you have a better functioning pelvic floor, it could have been the fact that you had tight muscles, and then in pregnancy they started to loosen up and relax a little bit, and then they were able to function more through their range of motion, because those muscles need to squeeze and relax rhythmically in order to propagate an orgasm. So I don't know, I didn't know your pelvic floor before to know which one it could have been for you, but it's possible.
Well, another factor could be just the expanded blood volume, because many people just are, you walk around pregnancy being a little bit aroused the whole time. You got swollen labias, you look like a freaking goddess, or a horror show, whatever. But, I think that plays a huge
goddess
role. No, but I mean, people have really different relationships to their genitalia.
That's true.
That tells us that our coochies are ugly. So that's not my thoughts on the subject, but because of that engorgement in the tissue and that kind of arousal, that's pregnant, and it's just juicier because of the hormones. We dry out postpartum. So, pregnancy, you often don't need any lube, but postpartum, especially if you're breastfeeding, you're definitely going to need lube. For many people, they will, just because of the hormonal changes. So it's another piece. Obviously, sex is really, it's really individual. It's really personal. Your partner's sexual response to your pregnant body or your postpartum body, you feeling like you're, less sexual because you're breastfeeding, it's a babe at your boob, all day long, and maybe you're sharing your body with one person, and that's plenty. So there's many, many factors that kind of go into it.
Yeah, thank you for that, Jane. But we would talk about that with you in an exam. And then if you're having any type of pelvic pain, so pubic bone pain, SI joint pain, and pubic bone pain can persist after you've had your baby. Neck, back pain. I think those are things we typically think of for physical therapy, but we can also work with you on your abdominal separation. And I've had plenty of people who have come to see me after their first kid and they're pregnant a second time, and we continue to work together through their pregnancy to keep exercise safe for them. So I don't nix abdominal exercise in pregnancy. I like abdominal exercise in pregnancy. I want you to hug your baby to your spine with your abdominals. Where it becomes a little dubious is when you're doing abdominal exercises that are too challenging for your level of strength. And then the muscles start to have dysfunction because they can't keep up with what you're trying to do. So there was a question about like what is and isn't safe with the diastasis. And I think that is extremely individual. If you go on the internet, you'll see people saying, don't do planks, don't do curl ups, don't do all of these things. And I have had patients with diastasis who repair their diastasis through a curl up. I've had patients who are completely safe to do a plank because their abdominals are able to manage that load. But it's not the thing I would say start with, right? Like start with some of the easier type of exercises for the abs where you're just working on like a Pilates style, like just a marching where you're laying on your back and you're just trying to draw the belly button in and do some marches. I don't know, Caitlin, if you want to speak to a little bit of that as well with the diastasis.
Yeah, no, I mean, I completely agree. It's to that individual thing. To your point, I had a woman the other day that had amazing tension, could generate that in a plank position. But then when I put her on her back to do marching, which is where I do typically start women, she don't. So it just shows you that each woman is so individual. And I have also had women that have healed through doing a crunch and a curl up. And you see all these programs online that say, here's the do list and the don't list. And that might be a good place to potentially start. And if you're not working with one of us to assess, like Liz said, like probably leg lowers, it's not the place to start. Probably crunches isn't the place to start. but you have to kind of know what you're looking for. So actually even just assessing and putting your hands, where you do have a little bit of that separation, and seeing if there's a little bit of bulging, coning, doming in that position, and check it out for yourself. Can I generate tension in these different positions? Ideally, if you generate tension, it should be about the consistency of your nose. If your hands just kind of sink in, or there's this coning or doming, that might mean that particular exercise you're not ready for yet. Or can you change your breath strategy? And you can do it. Can you do that exhale that we've been talking about, engaging that pelvic floor and core, and then that doming or coning goes away? Or, oh, okay, wow, I can generate tension here, but it's just so individualized.
I will say, and I would like your perspective on this, Jane, a little bit. I feel like with yoga, a lot of people get concerned, like, what can I not do? I feel like yoga is one of the things that tends to be extremely safe for a diastasis. The only thing I say usually to people is, like, don't go into full wheel position where you're doing a complete back, like a back bend, arching your entire body, because that tends to stretch the rectus muscles. You might want to stay away from that. And then sometimes you see like Navasana, like a boat pose, where that may be too much for the load of the abdominals. But typically you're not going to see those two poses in an early postpartum program anyway. So I would hope not.
I recommend, even for the yoginis out there, that they go to, if they're going back to yoga classes, that they start with a postnatal class so they can see what kind of postures are being taught. We absolutely don't do a full Urdhva Dhanurasana, which is a wheel pose. You want to shorten those muscles, get that tone back, not do a lot of lengthening. Even like a regular vinyasa class has an upward facing dog in it as you move through the vinyasa and the sun salutations. So I love the baby back bends, just like the little low cobras. They're really good back strengthening. So you can do back bending, but just not, I always say do the strengthening back bends, not the flexibility back bends. And then the other caution is, really doing really deep twisting where you're kind of cranking yourself into postures. So you do want to be a little careful with that. So I recommend going to postnatal classes. Once you start feeling a little bit stronger, what I do is I watch my students go through a vinyasa, so I can kind of assess, instead of coming down on a full chaturanga, drop your knees down until you can build up that strength so that you can lower yourself all the way down without doing what I call slumpasana. So that's when just like your pelvis slumps down and then your chest is like, free falls after your pelvis is on the floor. So it's just like taking those little baby steps as you build up strength, build up strength, build up strength.
Totally. And the only other thing I'm thinking about with the baby cobras is I found myself doing this in the past, where I would push my abs out into the floor beneath me to try to get more extension in my spine. And you definitely don't want to do that. You want to be drawing the navel to the spine, even when you're doing those extensions.
Well, it's funny. I teach them on the exhale because of that.
Oh.
Classically, we'll teach it on the inhale, but I'll cue to like draw the belly in, get that kind of zipping up and open up the chest from there. So yeah.
That's awesome.
Question for you, Jane, on that was, are there any concerns with deep twists postpartum? The person who asked is 7 weeks postpartum and has been avoiding it, but was just curious.
It really kind of depends on what's happening in your abdominal canister. So, there can be, if you've got a lot of diastases, you might want to not do a lot of twisting for shearing reasons of those muscles.
I'm not hearing you. Can you?
Can you hear me? Did we just?
I can hear you. I think Liz maybe is having some.
Oh.
You're good though on my side.
Yeah. So most of the extreme shapes in yoga, you want.
Yeah, it's me. Sorry, I just took my video off.
Those early months postpartum, those kind of extreme shapes. So you do the shapes that are less, expansive as you slowly begin to build your stability. I usually say go about 80% of your full flexibility for somebody who's a yogini and pretty flexible already, because the increased risk of injury can happen prenatally and postnatally as well. So you really want to focus on that stability before you kind of go into these bigger expression poses.
Sorry for my technical difficulties. I apologize for interrupting what you were saying, Jane. I couldn't hear what Allison's question was, but sounds like you did. So that's all that matters. And then a couple of things on here, like mommy's thumb, that's something PT could take care of, carpal tunnel syndrome, mastitis. So just in case you've heard about ultrasound for your breast for clogged milk ducts, there's actually not good literature based on that. So part of what we do is more of a traditional like Chinese medicine where you would use a gua sha to work the breast tissue. And it would be more of a massage or like using a vibrator in there in the breast tissue. But also, I mean, outside of that, sunflower lecithin is fantastic for clogged milk ducts. And then just like if anything, it just isn't feeling right, ask us. But don't feel afraid to get moving early on. I feel like I have a lot of patients who come in who say that they didn't exercise because they were just too afraid to move in their body. You know, I saw a question here about like, what kind of exercise can I do if I have a 2nd-degree tear? You can still ease into it. You can still start with walking. There's a question about cycling in here. As long as when you get on that saddle, you don't have discomfort and pressure in the perineum that's painful, you can sit on a saddle. I know Pelotons are super popular right now. And you know, they make a gel cushion you can buy on Amazon for like $14. You can put over your stationary bike seat or your bike seat at home. You can buy a bike seat that has a perineal cutout in it so that you have space for the vulva and the perineum. And put on some gel shorts so that you have like an extra padding between yourself and the bike. But otherwise, you know, I love cycling because if you're sitting on the seat, that's low impact. You're getting a little bit of increased intra-abdominal pressure when you stand and sit on a bike. But if you're able to do that without that heavy pressure feeling or leaking of urine, then I feel good about people using Pelotons, and I like them in general. But
Liz,
I guess
there was a question about, is the concern with running postpartum, is it around pelvic floor, like prolapse incontinence, or is it also bad for diastasis recti?
I would say in the early days, it's bad for everything. So just wait 3 months. It's bad for your joints. It's bad for your knees. It's bad, like your whole body, all of your joints in your body are coming back to normal at that point in time. So you're going to be more prone to injury in the first 3 months if you're running. In fact, I recommend a return to running program if you're going to do it. So if you haven't been running for a long time, there are lots of other things you need to work on. Like, and I'm sure, you know, Caitlin has done this type of work at Lotus Method in terms of like heel ups, calf raises off of the edge of a curb, making sure that you have your glute strength. You can stand up from a chair without using your hands, like a squat. There's glute medius strengthening. There's like fast feet type of drills and exercises where you're basically doing a mountain climber leaning against a wall. And that's important for the angle of the pelvis so that the pelvic floor is in its optimum position. Because the more that you lean back and the bigger strides you take, the harder that's going to be on your pelvic floor. We want to shorten those strides. We want to anteriorly rotate the pelvis so that it's in its optimal position. So it's not just about like getting back to running, but if you haven't been running for a long time, you have to ease back into it. So more like a couch to 5K than just like, I'm going to get out there and run, which Caitlin already spoke to. But I would like for Caitlin to be able to talk a little bit more about getting back to strength training. We're on her slide. So if you want to give us a little lowdown on getting back to strength training, we'd love to hear about that, Caitlin.
Yeah. So real quick, kind of what we do at the Lotus Method, it's strength training and functional movement. So we look at everything of during pregnancy, weight bearing exercise. We look at the structural positions that your body is getting into and work on, you know, preparing you for labor, and then what you're going to be doing as a new mom, asymmetrically loading, picking up a car seat. You're going to be leaning over a crib. So we look at all those movement patterns and figure out how can we best prepare you so that when you are, sets you up for a better postpartum. And then when you are postpartum, you don't have to worry about that as much as you're going through that healing stage. You have some body awareness. You have a little bit of pelvic floor and core connection. So we primarily work with women one-on-one. And the reason for that is kind of, we were talking about that kind of specificity. So we really tailor it to each woman where they're at. So as far as getting back into strength training, and I can cover running a little bit as well, we do always start with the breath. So that's the first step, is working on integrating that pelvic floor and core again into the movement patterns. And then from there, we're going to look at the movement patterns you're doing as a new mom. So You're probably getting up off of a couch holding a baby after you've been feeding, right? So a sit to stand pattern, a squat pattern. You are leaning over a crib, you're picking up your car seat. So we do a lot of doing a lot of carries and hinge patterns where you're really loading into the glutes. And then, you know, push, pull, working on that upper body strength, that asymmetrical load. But really with any modality, whether it's strength training or running or yoga or Pilates, as we've been talking about this whole thing, you really, like Jane said, you want to lay the foundation and then build on there, right? So it doesn't matter which modality you do, you really want to take the time to integrate your pelvic floor and core, make sure that everything's feeling okay, listening when you do feel tugging of your C-section scar or heaviness in your pelvic floor or leaking. Those are signs that something might not be working as optimally as it could. And that's kind of a warning sign of like, hey, there's some exploration here. And if you're doing that exploration on your own, just see if changing things like Liz was talking about alignment with running, seeing if like you can stack your rib over hip as you lean forward. Does that change the sensation of heaviness? If you're picking something up off the ground, if you are doing strength training, or if it's a car seat or your baby, can you get a little blow before you go? Can you exhale to initiate that movement and have that pelvic floor and core assisting you before you go and pick something up? So connecting with that rib over hip, looking at alignment, and then seeing if by integrating your pelvic floor and core, does that change either a sensation of pain, of heaviness, something not feeling right, leakage, doming coning, if we're talking about diastasis. So using those kind of check-ins with yourself to see like, hey, is this appropriate? And if something's not feeling good, you know, honoring that and taking a step back. We want you to be able to lift and run for the remainder of your life, and not go too far too quick and then spend more time kind of in that healing process. And with because we're getting a lot of questions about returning to running. As Liz said, that, you know, that alignment, that kind of stacking your rib cage over your pelvis is a really good thing. And then as she was talking about, what we tend to do in here is after we've kind of worked on like, okay, can this woman load through her glutes again? Is she integrating her pelvic floor and core? Then we're going to do things like stomping, quick feet, actually working on single leg stability actually would come before the stomping and quick feet. But, and then eventually, can you do a little inhale, exhale, and do a jump? And then wait a day or two, see how you feel, because you're starting to put impact on that. You're starting to load that pelvic floor in this higher dynamic way. Can your pelvic floor meet that demand? And if it can't, cool, we got to take a couple steps back and we got to do some other things before we go and hit the pavement and go for a run. Did I freeze?
Do we have a slide for Jane? Yeah. Okay.
Yeah.
Oh, yeah. Well, I mean, just to build on what Caitlin was saying a little bit, just in terms of, you know, learning, like relearning how to use your body. Your body has undergone one of the greatest physiological changes that you will ever experience, short of being born and dying. So, you know, there's definitely going to be like postural changes. So noticing how you're holding your body when you're feeding your baby, if you're slumping, you know, we're tired, we sit in a slumped position. So trying to bring some awareness to how you're feeling physically, mentally, emotionally. And really that's what yoga is. And of course, I love the physical component because I can geek out with PTs and you know, physios and people who specialize working with on that physical plane. But yoga integrates the whole experience. And that's like what I was speaking about earlier, being able to pay attention to the sensations that you're feeling so that you can create space for everything that's present. And I think that sometimes, you know, we're supposed to like not look like we had a baby when we just had a
Right.
baby. So, I mean, that's like pathological to think that you're not supposed to look like you had a baby when you just did. So giving yourself some space, honestly, you know, one thing I do recommend for postpartum folks, and obviously pandemic's a little bit different because most of us are wearing really stretchy clothes, but like buy clothes that fit your body. Instead of looking into your closet and being like, oh, when am I going to get into those? I don't know. I don't know when you're going to get into those. Maybe sometime soon, maybe never again. But so that there isn't this sort of, you know, even when you're just putting on your clothes, that there isn't this sort of like battle with your body. So you get pants that fit you so that you can zip them up and you can feel good. And part of that is just being kind to yourself. And we cultivate that on the mat. I mean, I feel like, you know, inhale gives us the opportunity to kind of build our strength and our stamina, and our exhale just lets us soften a little bit. So like physically you're engaging and lifting up when you're doing exercise, but when you're sitting on your mat and you tap into your exhale, I sometimes call the exhale mercy. I call it compassion. I call it love. So yoga integrates like the physical, but also the mental and the emotional piece. So I love this picture of me holding a baby. Oh my God, remember a baby holding?
I know.
I held many a babies in your classes, Jane.
Yeah,
I
Jane,
was
we
like,
did
I
have a
need to- I
question
wanna
about
be there.
when will you be, we did have a question that someone wants to know when you'll be offering in-person classes again. Clearly people are excited to get back to the mat and with you.
We were just talking about that. I've been teaching all my classes on Zoom, you know, since the beginning of the pandemic, which is not the same, of course, but it's still lovely. I'm hoping in the fall that I will have in-person classes. I probably won't start anything this summer. So I've got some offers from a couple of studios in San Francisco. I'm trying to find the right fit, but I will probably forever be teaching classes on Zoom because I've got students from all over the world now. And, you know, people who lived in the Bay Area when they were pregnant the first time get pregnant again. And she's doing yoga with me from, you know, Connecticut or wherever. So I will definitely look for me in the fall for sure. And it'll be on Instagram. I'll make announcements and everything.
I think there's also something really to be said for virtual care because you have the ability to do it from your home. And like you said, if you move to Connecticut, you can still do it. So full disclosure, I think I have a broken foot. I was driving home, pulled off my car on the side of the road, had a doctor's visit in about 10 minutes virtually on my phone, then got back in the car and made it home to pick my kid up from school like at 3 p.m. So, you know, I think that there's a lot that we can do now with virtual that we used to not be able to do that gives us that space and time and to do it on our own time. And we don't have to have the driving to find a parking spot in San Francisco and all of that hassle that comes with that. And I know it can feel really foreign to trust movement in your body to a professional over video, but you would be really surprised how good we are at it. So, and what
We got good real quick.
What you can gain from it.
We had to figure it out. We figured it out.
Yeah, I have talked to many a woman through her own virtual vaginal exam, camera off, and have gained a lot of knowledge about themselves. I know that's not for everyone, but it's doable.
But even showing women how to check for diastasis.
I think that that's it for our slides for today. Sorry, what was that, Jane?
Oh, just teaching the postpartum folks how to check for diastasis. I mean, it's obviously not the same as a clinician's hands, and I'm not even a clinician, but I've, you know, palpated thousands of, you know, postpartum bellies.
Of course, yeah.
But even giving them the power to like feel their own body so that they can make an assessment, just to not like a clinical assessment, but see what they feel. You know, I'm all about supporting my my students to touch their bodies, because, you know, it's the only one.
Oh, and I am the first person. I mean, like, I'm like the most clinical person on this call, and I'm the first person to say that clinical doesn't always matter. You know, if I have someone come in and they told me that Jane or Caitlin looked at their separation, I'm like, okay, cool, they know what they're doing. And, you know, and I had a patient today who came in and saw me and told me that she was told by a clinician what her degree, her separation was. And she's like, and that just doesn't feel right to me, because when I feel it myself, it feels like this. And so I checked her and I was like, you're absolutely right. You knew what your own situation was better than that other person who looked at you. And I think that that can be hard, you know, when we intuitively know something in our body and somebody else is telling us something different. So when I'm working with my clients, I always ask them, like, does what I'm saying jive with what you're feeling in your body? Because if it doesn't, I need to go deeper to figure out why I'm missing it, you know. And if your provider's not doing that with you, or people are, if you are working with a trainer that's not specialized in pre and postpartum, and you're saying this doesn't feel safe, and they're not hearing you, it's probably time to find somebody else, because you do know your body better than you think you do, I think. We have about 9 minutes left, and we have a string of questions, Allison, from before the call that I know we haven't gotten to yet. Have there been any other questions that have come in since we've been talking that I've missed?
No, I think there was a couple around just like prolapse and thinking about that, in like returning to running, you know, how should we think about that was really, I think, the only other one that we missed. And one just came in about, that I can respond to directly. So yeah, we can go through the ones that were submitted ahead of time, or if you can answer that one around prolapse and running.
Can you remind me what specifically the question around prolapse, right? Like,
Sure.
I saw that
sure.
one. Can
The
you read
question
it to
was,
me?
how should I think about running and prolapse? My OB says talk to my PT. My PT says talk to my OB.
Okay. So I typically recommend, if you have a significant enough prolapse that it's bothering you to the point that you feel like you don't want to run, that you get fit for a pessary. So a pessary is a little piece of silicone that you can put into the vagina, and it will hold everything up for you. Some people don't like the idea of using a pessary. I really talk about it like in a way where if you had an injured ankle, like if you sprained your ankle running a marathon, would you go back and start running a marathon without an ankle brace on? No. And would you wear your ankle brace forever? No. You would do the necessary strengthening that you needed to do to wean yourself off of it. You could put a pessary in just for the run and then remove it when you're done with the run. If a pessary is not for you, I would say make sure that you start with your pelvic floor strengthening and get to a place where you have enough of a lift against gravity that you can go for your run. Okay. I think one of the hardest things with a prolapse and running is that the more weight that's in your abdomen, the more pressure there is on the prolapse and the harder it feels. But if you can't go for a run to lose the weight, how are you going to fix this problem of the weight on the prolapse? So I'm kind of an advocate for, you know, as long as it's not increasing your symptoms significantly, go ahead and go for the run, because you need it for your sanity. You need it to reduce the weight that's sitting on the prolapse. And then there are different people, their pelvic floors respond differently to running. If I do a pelvic floor exam on myself after a run, which of course I've done because I do it all the time in weird ways all the time. And my pelvic floor is stronger after I go for a run. It's like I activate it when I run. So and other people are going to have a different experience with that. Their pelvic floor is going to feel very loose when they run. So if it feels okay to you, the symptoms aren't getting worse when you're running, then I don't have a huge issue with it. But don't go try to run a 7-minute mile, like do a 9.5-minute pace, try a mile, work your way up to 3 miles. If you start to notice that point where it starts to get worse, that's where you need to back off. I hope that answers that person's question. I saw another question in the list about my personal trainer told me I needed to lose my visceral abdominal fat before I could do core training. No. So if anybody knows what visceral fat is, that's fat around your organs underneath your abdominal muscles. And for sure, if you have a lot of visceral fat, like in your organs, it's going to make your abdomen pooch out more, just because there's more things in there pooching out. But that's no reason not to start core strengthening. And when it comes to losing belly fat, like I think there's a lot of people out there, it's like, oh, if I do a ton of crunches, I'll lose belly fat. There's no such thing as spot reducing. You can't work one body part and lose the fat in that one body part. You have to have full body workout, and your fat is going to go from wherever your fat goes from first. My fat leaves my boobs first and goes to my ass last. And I want a big fat booty, and and I can't get the fat to go there, and it all leaves my boobs, and I want fat there too. So it all wants to go right around my center and stay there for the longest period of time. That's the hardest place to lose it. And that's partly because of hormones, and that's estrogen. And you'll notice that when you go through menopause too, because when we lose estrogen, like that is fat is it creates phytoestrogens, and our body wants to hold on to it and it doesn't want to let it go because that's a source of estrogen for the body. So it can be the hardest thing to lose, but really your best way to lose weight is going to be high intensity interval training. If that's what you're trying, if that's really what your aim is to get rid of fat, it's going to be high intensity interval training, but you don't need to not do core work. Caitlin, this I think is really your realm if you want to talk about that in more depth.
Yeah, I mean, I think you nailed it on the head. If there's no such thing as spot reducing, and if you're looking to lose weight overall or in a specific area, you've got to be in a calorie deficiency. Like that's how we lose weight. And then as far as like high impact or interval training, listening to what your body can handle. So if we go back to if this person has prolapse or diastasis or something like that, you've got to be mindful of that, and weigh that of the risk versus reward there, as Liz was talking about. The heaviness of like weight on the prolapse can be something to factor in, but there's lots of ways to get impact without actually doing impact. And what I mean by that is like cardiovascular, just even like, how you lean down and pick up like a toddler, like you can do that movement with a weight and that will get your heart rate up, right? There's ways to do this kind of like HIIT training without actually jumping or running, and get that kind of cardiovascular burn, that heart rate up, and mix that in with intervals and strength training without like, oh, okay, I have to go and run 17 miles a day in order to lose this weight.
And I just want to address, sorry, I saw Eve leave a message in there who has an appointment with me in a few weeks. I would switch providers, Eve. So we have other providers in the clinic right now that could see you, that sit next to me all day long. And I could, we can discuss your case and they can work with you if you want to get in sooner so that you can get working. I just see that it looks like you're seeing me about when you're due, which might not be very helpful if you miss your appointment because you're in labor. But if something you could be doing immediately now would be stretching the perineum. So getting it ready for birth, and opening that up, but not forcing it. Just go with the ease of the muscle, using your thumb or having a partner do it, give some pressure to it, ease into it, use lubricant, breathe with it. And then if you're having issues with strength, maybe just start to connect that muscle, that breath and the squeeze and the relax. I feel like we're kind of at time here. We've got 2 minutes left, and Allison suggested that we end with a nice deep breath. I feel like maybe we should have started with that, but Jane, would you like to lead us just to like in a little, like a closing, I don't know, like
Yeah, sure.
breath work. I'm going to close my eyes and meditate here while you maybe do a little gratitude for us. Would that be possible?
Yeah.
Sorry to throw you on the spot, but I would just
No, it's what I do for a living. So it's
cool.
okay.
Thank you.
Be like, hey Liz, can you do a quick pelvic floor exam?
Sure can.
You can do it on the fly. So I'm just going to invite you. We only have a few moments left together. So just to close our time, just take a moment, find a comfortable seat. So if you've been kind of slumping a little bit in your seat, really feel the connection of your sit bones grounding and rooting down to whatever you're sitting on. From that grounded, rooted place, grow the spine. And as we do so, just allow yourself to feel a little bit more spacious in your body. Reaching the crown of the head up toward the sky. And what we know is that a deep conscious breath is nourishing to our bodies and mind. And if you're feeling anxious in your day and in your life, or stressed or overwhelmed, tired, take a moment, give yourself the gift of a conscious breath. You don't have to roll out a yoga mat, doesn't have to be anything fancy. Maybe close your eyes or focus on one point and take a deep breath. And I'm just going to teach you just a really quick breath. This might go slightly over, so if you need to log off, it's fine. And this was taught by a guru teacher of mine. And this was my daughter's and son's preschool teacher. Oh, we're gonna do a really good breath for kids. This is a kid breath. So as you take an inhale, you smell the cookies. So you breathe in through your nose. So smell the cookies and then blow out the candles. Smell the cookies and blow out the candles, maybe candles on your birthday cake, just a couple more times, just like that. Do this for yourself, for the mamas, do it with your kids. So if somebody's freaking out, just start smelling cookies, inhaling through the nose and exhale through the mouth, blowing out gently.
Just come up with that.
So thank you, everybody.
Thank you so much, Jane. Thank you everyone for joining. We will be sending this out, sending out a recording and sending out the webinar to all of the everyone who was registered. And if there's any questions that we couldn't answer, feel free to shoot us a note at hello@theoriginway.com and we'll try to get back to you guys. But thank you so much, Jane. Thank you, Caitlin. And thank you, Liz.
Thank you.
It was really fun.
It was
Have a
fun.
good night.
Thank you guys.
Good night.